What are the difference between PPI and antacid? What are the difference between PPI like omeprazole, pantoprazole, rabeprazole, and antacid like calcium carbonate, magnesium hydroxide? What are the differences? What are the similarities? What are their clinical uses? I am pharmacist Pharm.Ezekiel. In this video, I will be answering this question because many patients confuse antacid with omeprazole. In this video, I will be explaining each and every one of them in a layman understanding so that after this video, you will never have to confuse between antacid and PPI. That's proton pump inhibitors like omeprazole, pantoprazole. They are not the same. They work through different means, they work through different ways, and they do this to minimize and stop the increase of acid. Remember, if you have not yet subscribed to this channel, I plead with you, click on the subscription button, subscribe, put on the notification button because I'll be dropping videos every week to bring you health informed tips and medicine related information. Let's go into the video. What are PPIs? Proton pump inhibitors. PPIs, that is proton pump inhibitors, they work by blocking the acid producing pump. They block the acid producing pump, and in other words, they reduce or they stop the production of acid into the intestine or into the stomach lining, and by this they reduce the amount of acid in the stomach. In what cases can we recommend or use PPIs? Number one, in the case of GERD, G-E-R-D, gastroesophageal reflux disease. Number two, the case of peptic ulcer. Number three, in the case of production of acid disorders. In the case of heartburn, a case where a patient experiences heartburn all the time. That can be a sign that there is an increased production of acid, and a PPI can be deployed. Then the PPI can also be used to prevent ulcer, especially those who take NSAIDs, N-S-A-I-D, that is non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, and naproxen, and the rest. So PPIs can be used to prevent the case of ulcer, especially those who are prone to ulcer and those who have the likelihood or the tendency of developing ulcer. Example is in the case of a patient that always, like I said before, that always have heartburn. In that case, that patient does not need antacid per se because the heartburn is reoccurring. It needs a PPI that will stop totally the production of acid, which will in turn reduce or minimize the issue of heartburn. What are antacids? Antacids are used to neutralize acid in the stomach that has already been produced. Are you following? As antacids are used to neutralize acid in the stomach that has already been produced. Common uses of antacids are in occasional heartburn, in acid indigestion, in sour stomach after heavy meals. For example, a person who just finished a spicy food or a high peppery food, you see, that kind of person can start having heartburn. In that case, the person needs a quick relief. What are the advantages of PPIs and antacid? What are the advantages? For PPI, that is proton pump inhibitors like omeprazole, pantoprazole, rabeprazole, their advantages are these. Number one, they are more effective in chronic acid-related conditions. That's number one. Number two, they help in the healing of ulcers. They don't heal ulcer, but they help to hasten the healing of ulcer. Then number three, they can also be used to prevent ulcer. Yes, they can be used to prevent ulcers. Number four, they have longer duration of action. Before I come to antacid, the advantage, I want to talk about the possible side effects. What are the possible side effects of PPIs? Some of the possible side effects are headache, nausea, diarrhea, and most importantly, when you take it for a longer period of time, it can cause the reduction in the absorption of vitamin B12, calcium, and magnesium. And when these vitamins and these essential nutrients are not absorbed for a longer time, you start noticing something like pain, muscle spasms, nerve issues, and all of that. So these are the possible side effects of PPIs, proton pump inhibitor, like omeprazole, pantoprazole, and the rest. What are the advantages of antacid, like calcium carbonate, magnesium hydroxide? Number one, they give quick, rapid relief. Number two, they are good for occasional symptoms. Number three, they are easily available. And number four, they're also cheap. We have cheaper brands of antacid that you can afford. Everyone can afford an antacid when needed. What are their possible side effects when taken wrongly or for a longer time or in a higher dose? Number one side effect is what we call constipation. You'll be finding it difficult to pass through. you find it difficult, your stool will be very hard because of some of the antacids contain calcium. They contain calcium carbonates. And so this calcium carbonate, if taken in a large quantity, even some of them contain aluminum hydroxide, which can also cause constipation. When taking a large dose or taking for a longer time, you experience constipation. It can also cause diarrhea. Some of these antacids contain magnesium substances. And so these magnesium substances, when taken in a higher quantity, can cause diarrhea. Lastly, they can cause electrolyte imbalance if overused. These antacids contain magnesium, calcium, aluminum, some contain other electrolytes. So if overused, it can cause increase in some electrolyte and decrease in some electrolyte, which in turn cause imbalance. And the person may not be able, will start having some symptoms like weakness and all of that. So which one are you supposed to choose per time? Number one, if it's occasional heartburn, maybe after you have finished eating, you can take an antacid to quickly relieve your symptom. But if the heartburn is a long-time kind of heartburn, even after eating or before eating, meet your doctor, see your doctor. He or she will recommend a PPI, that's proton pump inhibitor, because that will help you in that. And if you're having GERD, gastroesophageal reflux disease, a PPI will help you in that condition. So what are the takeaway in this video? Antacid gives you quick and rapid relief. Why a PPI, though they take a longer time to work, but when they start to work, they can give you a longer and lasting relief from your symptom, and also go a long way to prevent many other symptoms as the case may be. Antacid neutralizes the acid that is already there, while a PPI stops the production of more acids. Are you seeing the differences? Are you seeing their similarities? Are you seeing their clinical uses? That is why you must follow me. That is why if you're watching on Facebook, TikTok, you must follow me for more of this information. And if you're watching me on YouTube, don't leave this video. Please subscribe. Till I come your way next time, I still remain Pharmacist Ezekiel Uzumba. Thank you for watching.